I've got impingement in my hip, so I've got to have surgery. Is this true? If you've got impingement in your hip, does this actually mean that you would have pain and therefore you need surgery? Or can you actually have impingement in your hip without pain and be fully functional? So your hip joint consists of the acetabulum, which is the socket in the pelvis, and the femoral head, which obviously fits into that socket. And basically this is called femoroacetabular impingement syndrome. Now you can have a cam or a pincer style of impingement. Both are bony prominences that may develop, or maybe they're already to begin with. They can cause labral tears, they can cause pain, they can cause issues. But can they be there in normal, asymptomatic individuals and even in young individuals? There was a study done here where they looked at 67 male collegiate football athletes. None of them had pain, and they had 2 orthopedic surgeons independently evaluate these radiographs of the hip to see if there were signs of impingement, whether it cam, pincer, whatever. And this is what they found. They found 95% of the hips had either a cam or a pincer. 77% had more than one of these signs, because you could have a cam and a pincer, for example. 21% just had a cam. 57% had both. 52% had just a pincer. 10% had 2. And 4% had all 3 signs. So this really does show that you can have femoral acetabular impingement syndrome in a hip in young people who are sporty, who have no pain, who have no restriction, who have no issues. So again, it always boils down to what the irritation component of this problem is, and perhaps even what the strength of this person is, the flexibility of this person is, but also their tolerance as well. And it does show you that these things can be present in normal hips and therefore don't necessarily need surgery, and maybe don't need anything, of course, in this case, because they were all pain-free. So this shows you that impingement syndrome in your hip doesn't have to hurt, and it doesn't always hurt. It can hurt, of course, and I've even treated patients who've had this issue conservatively done well, or conservatively not done as well and needed surgery because of the problem not resolving. So it depends, is the reality, as always with these things. But don't just take it as, oh, I've got impingement syndrome, whether it be cam, pincer, whatever, and think, that's it, there's no other options, I've got to shave that bit of bone off and sort the thing out. It doesn't always work that way. But that's it for this video, and I'll see you next time.